Hi, I'm Dr. David Hill, and today we're going to be talking about symptoms of chest pain in a child. Now, chest pain is always alarming initially. I don't know that chest pain is okay until I've done some things to figure out if the chest pain is okay. However, there are some different presentations of chest pain that may be more or less concerning. So let's talk about what might go with the chest pain. The chest pain that bothers me the very least is chest pain that's localized to one very specific site and is associated with a particular movement or exercise, especially in a young athlete. What can happen is a child can get some inflammation of the cartilage, the soft tissue between the bones, especially if that child lifts weights or does some form of exercise. That inflammation can become quite painful. Usually it's sort of sharp in nature and it's present every time you push in that location. The child can usually reproduce it by moving the arm or the chest in some way. That chest pain is not terribly alarming to me, and it may respond quite nicely to ibuprofen. Now, chest pain that occurs with exercise but is not reproducible or not tender right there bothers me a lot more. The two most common things that could be happening are asthma or some form of heart problem. Asthma may cause chest pain even without a lot of wheezing and cough. That may be how the child describes the asthma symptoms. Could be a chest tightness or discomfort, but they really don't know a good word for that, so they just say their chest hurts. Especially if that's reproducible with exercise, it suggests that we need to get a listen to the lungs, screen for other asthma symptoms such as exercise-induced cough or nighttime cough, and see if that child needs treatment. Now, heart pain may be associated with palpitations, fast heartbeats, easy fatiguing, where the child gets tired real easily. That's never a good thing, obviously. So you're going to want to get that child into a doctor so he or she can listen to the chest and consider getting other studies like an EKG or an echocardiogram to see what's going on with the heart. So, bottom line, there are some chest pains in children that are not alarming, but until I've done my exam and possibly some breathing tests or a chest x-ray or an EKG or an echocardiogram, I'm never quite sure myself. So if your child's having chest pain, don't delay. Get a doctor to see him or her and try to figure out what exactly is going on. Talking about symptoms of chest pain in children, I'm Dr. David Hill.